Hey guys, David Straney, physiotherapist here. Now, once you, a family member or a friend has had a stroke or a transient ischemic attack, a TIA, you might be wondering and asking yourself, how quickly can I start exercise? What types of exercises can I do? And how hard can I perform them? But before we start, it's important that prior to engaging in any exercise that you do get clearance from your medical professional, neurologist, or treating therapist. The short answer to the question is, if you've been in hospital and you've engaged in some form of exercise, it's a big old fat yes. But there's a little bit more to it. Now, depending on the location and the size of your stroke, this will impact your symptoms, impairments, and current function. So no two people will have the exact same starting point or trajectory of recovery. But exercise in any capacity is paramount in maximizing your recovery and neuroplasticity. There are precautions and contraindications, or red flags, to exercising that everybody, even those without a stroke, must be cautious of. As mentioned, if any of these do pertain to you, please get clearance before starting an exercise regime. These can include, but are not limited to, cardiovascular heart conditions, including acute myocardial infarction or unstable angina, uncontrolled cardiac arrhythmias causing symptoms or hemodynamic compromise, symptomatic severe aortic stenosis, uncontrolled symptomatic heart failure, acute pulmonary embolus or pulmonary infarction, acute myocarditis or pericarditis, acute aortic dissection, uncontrolled seizures, an unstable medical condition, recent surgical medical procedures, or any history of adverse effects post or during exercise. A major concern that people may have when exercising after a stroke or a TIA is, will the stress of the exercise increase your risk of having another stroke? Thankfully, we don't need to worry about that. There is no evidence to suggest that exercising will increase your risk of a stroke. For example, in a study by Johnson et al., 2019, they performed a graded exercise test in 29 people who had a stroke or TIA within the past 14 days. These individuals were pushed to test their maximal capacity of exercise with no serious neurological or cardiovascular events following from this. Additionally, all major research and stroke groups promote and recognize exercise as a way to reduce these major risks of having another stroke, including lowering your blood pressure, cardiovascular risks, and other risk factors associated with these conditions. Okay, so it's okay for me to exercise, but when? In hospital, if medically cleared, which will be most cases, you'll most likely be engaging in some form of exercise within the first 24 to 48 hours of having your stroke. One large study, avert, a very early rehabilitation trial, compared very early intervention within 24 hours compared to usual care of intervention after 24 hours post-stroke. The most recent stage 3 phase of these trials did demonstrate this very early mobilization protocol was associated actually with reduced odds of favorable outcomes at 3 months. However, this is compared to usual care, in which 60% of patients receiving usual care had started out of bed therapy within 24 hours of stroke onset. This, at the end of the day, is something that most people won't need to worry about, as your rehabilitation in the hospital setting will be organized and managed by your multidisciplinary team. So, if you've been discharged from hospital and you have already engaged in some form of exercise, then you will be okay to continue right away. Exercise can be done at varying intensities. For example, I could be walking slowly, which would be considered low intensity, or I could be sprinting to my maximal speed, which we would consider high or vigorous intensity. It is important to note that intensity is subjective though, and we all have our individual exercise tolerance. For example, for one person, walking 25 to 45 minutes may be a slow, low intensity exercise which results in minimal fatigue, heart rate increases, and muscle fatigue. Whereas for another person, it can be incredibly challenging, highly vigorous activity resulting in significant physiological stimulus. The NHS defines moderately intensive cardiovascular exercise as activity that will raise your heart rate and make you breathe faster and feel warmer. One way to tell if you're working at a moderate intensity level is if you can still talk but not sing. So if you can sing, it's probably lower intensity despite how good or bad you can sing. And if you're not really able to speak at all, then it's likely you're working at a higher vigorous intensity of exercise. We can always go deeper into this, looking at heart rate and other measures to gauge intensity, but I think that's something for another video. Current stroke guidelines recommend you to be active daily. This could either be 150 minutes a week of moderate intense activity or 75 minutes of vigorous activity, which carries us to the next topic. What types of exercise should you be doing? Exercise types can be broken up in a million different ways. For this video, we're going to be focusing on just 5 different types we could group exercises. Cardiovascular exercise, strength or resistance training, flexibility training, balance exercises, and coordination or proprioception-based exercise. Your exercise choice or program should be tailored to your individual impairments and current goals. Most likely, you'll be doing a mixture of all of these exercises, with more of a focus on 1 or 2 of these types of exercises, which will target or address your major goals. These exercises could be structured in a formal exercise program, for example, performing 3 sets of 15 of a TheraBand overhead press to build up strength in your shoulders, or have less structure relating more to activities of your daily life. For example, going for a walk 3 times a week to the shops and returning your groceries in your cupboards without assistance. It's important to note that these exercises may be achieving multiple goals at once. For example, using a dowel to bring your arm overhead can improve your flexibility and range of motion, as well as your strength in the shoulder and arm complex. And walking can improve cardiovascular capacity, balance, coordination, and muscular strength and endurance. With all types of exercise, we want to adhere to the principle of progressive overload. Essentially, do a little bit more every time. If week 1, you are starting with 10 minutes of walking a day, week 2, try to walk 12 minutes or 15 minutes. If you're starting lifting a 2 kilogram weight for 5 repetitions, try to add 1 more rep every session. Once you can do, say, 10 to 15 repetitions of that weight, increase the weight. You might start doing less repetitions initially, but your body needs increasingly challenging stimulus to promote neuroplasticity and positive changes to occur. Now, the most important thing we'll need to talk about today is compliance. The best exercise that you're going to do is the one you're going to adhere to. To achieve your goals, you're going to need frequency and consistency with your exercises. Remember, recovery is a journey. It's not a sprint, it's a marathon. So the longer we can build up reps with all of these exercises, the more change and growth will occur. So choose something you enjoy and you can adhere to. I would never prescribe my patient an exercise they hate and expect them to be able to do that consistently. It's just not realistic. So if you don't know what exercises to do or how to structure your week around them, please contact your physio, OT, exercise physiologist, or healthcare provider so they can assist you with this. Thank you so much for watching the video. Please let me know if you have any questions in the comments or any suggestions for future video ideas. Peace.